Hey everyone, Dr. Ray Heiss here at Revive Sport and Spine. I've got something that I want to share with you today. I was working with a golfer yesterday and I thought this would make a great video because it's something we see frequently that can be worked on at home and maybe prevent injury, help you enjoy the game more, and also hit better, which is always what we're trying to do without having back pain, hip issues, and things like that. So what came in was it was part hip pain, part low back pain, and we see these two play off of each other. So what I want to do is talk about this. So as a right-handed golfer, my front leg has to have a good amount of internal rotation. So when we come through a swing, we have to be able to internally rotate at this hip. Now the problem we see is this is one of the first range of motions to go in the hip. Most of us have plenty of external rotation where we can turn that out, mainly because we sit in that position a lot of times. But that internal rotation, as we get older or we don't work on our flexibility enough, this actually gets pretty tight and this can cause a lot of problems. So if we lose that internal rotation, we take that mobility from the hip and put that here on our low back. So instead of coming through and trying to work into that hip, we take it in the back. And a couple things we'll see is the golfer will either slide into a hit because they can't rotate, they'll slide into it, or we'll get early extension where we come through and we open the hips up, and that really messes up our striking on the ball, and that can also cause some other problems with the low back. So I've got two exercises I want to show you that you can do at home, you can do as part of your warm-up that's going to work on this hip internal rotation. So if you are sliding or you are being an early extender and opening that up because you can't get into this range of motion while you're in a good golf posture, these are going to help you out. Our first one is going to be what we call a 90-90 position or a shin box, because basically you're making a box here with the shin. Some might find getting into this position hard, so you may have to open that up a little bit and sit into a more open position. But our goal here is to get to where this foot is on this knee and you're able to sit up tall. Now, the way we're looking at this is this leg is actually an external rotation. This one is an internal rotation. So what you want to try to do is get up nice and tall. You'll be able to feel this in the crease of this hip, but once you do, we want to be able to lean forward and come back out of that and do that 10 to 15 times, because as you lean forward, that's going to push you into internal rotation on this one. Once you do that side, always keep it balanced. So now my front leg as a right-handed golfer is now in internal rotation. And as you notice, I'm having a little harder time getting here. So I feel this on the front side of this hip and actually over my SI joint on the back. And that's where that low back pain can come in when you have poor hip mobility. You're taking the pressure off of here and I'm putting it on here, and that can break down a little bit faster. So same thing here, I want to get up to where I'm nice and tall and I just want to lean forward and come out. And you can notice I don't have as much mobility here. This is something I have to work on frequently. So this is the 90-90 exercise. This is a great one to work into your drills. Again, if you don't have the mobility, you can open this up and start working in here, but you will feel it on the inside of this hip, and that's what we're shooting for. Our next exercise is going to take a little bit of equipment. And what we're trying to do here is, granted I have this strap, but you can just use a long exercise band if you have one. What we're gonna do is loop this through an arm. We're gonna bring a rotation into it, and what we wanna do is slowly load ourselves into that internal rotation and then slowly come back out against the resistance of the band. This eccentric contraction helps get a little bit more flexibility through the muscles, but it also stabilizes the joint, which is going to keep you solid over this hip joint, but it's going to work on those muscles. So what you're going to do, I'm going to show it on the left because I'm facing the camera, but I am a right-handed golfer, so I would go through with my dominant arm. So what we're going to do is loop it through our arm and we're going to spin. And I had this set up about waist height coming from the side here. So I'm getting a pull this way. So if I get down into my golf position, it's going to pull me into internal rotation here, okay? So from that, I'm going to work into my backswing, and then I'm going to slowly let this pull me into on this side. But what I want to see is if I was a left-handed golfer, if I was facing the other way as a right-handed golfer, I want to take this resistance, get into my follow through right into that internal rotation, and then I want to slowly come back out of it. So I'm controlling that with my hip and getting that motion coming back out of there. And what that does, it helps build up that resistance, because we're coming through dynamically into this hip, into internal rotation. But as I get there, I want to slowly come back out of it. So this one takes a little bit of practice, and you do need a little bit of equipment for it, but we want to take that golf swing, slow it down, and work on coming out of that end range, letting that hip control it so we actually get that range of motion, that control, that eccentric contraction from the exercises there, and be able to, open that up, decrease that back pain, prevent that slide or that early extension because we don't have the hip mobility. So those are 2 drills to work on for you. Let me know if you have any questions. If you're having consistent problem with golf injuries, we are a certified Titleist Performance Institute provider in the Salt Lake area. We can do an assessment, we can do a full fitness assessment and see where you're breaking down in your swing or with your warm up or anything else, and help build you a program that can address those things so you can play pain-free and you can have your best round yet.